When you're planning for a hot night under the sheets, you might not want to think about STDs. Knowledge is power when it comes to your sexual health. So today, we will discuss top 20 sexually transmitted diseases along with their symptoms and treatment. Number 1. Hepatitis B. There are 3 different kinds of hepatitis. Hepatitis A, B and C can all be transmitted sexually. However, hepatitis B is the type most likely to be sexually transmitted. Symptoms may include joint pain, skin eruptions, a hive-like rash, fatigue, loss of appetite, nausea, vomiting, headache, fever, dark urine, jaundice, and liver enlargement and tenderness. There are no specific cures for HIV or HBV. Number 2. HIV or AIDS. The HIV virus that causes AIDS is transmitted by blood and body fluids. A person infected with HIV can remain healthy and symptom-free for many years. If HIV leads to AIDS, serious symptoms can develop and can ultimately lead to death. There is no cure for HIV, but there are treatment options that allow HIV-positive individuals to live long and healthy lives. Number 3. Chancroid. Chancroid is a bacterial STI that is only spread through sexual contact. It causes painful ulcers or sores in the genital region. Symptoms. Women with chancroid often have no symptoms. Men will usually have a painful erosive ulcer with ragged edges somewhere on the penis. Chancroid can be treated with antibiotics. Number 4. Trichomoniasis. Signs in women include excessive, frothy, yellowish or greenish vaginal discharge. There may also be swelling of the vulva and labia along with painful urination. Symptoms in men may include painful urination with lesions on the penis. Treatment. Trichomoniasis can be treated and cured with antibiotics. Number 5. Human papillomavirus, HPV and genital warts. HPV is the most common STD and at least 50% of sexually active people will get it at some time in their lives. There are more than 100 different types of HPV. Most of the time, there are no symptoms and the virus clears on its own. Number 6. Herpes. Herpes is a common STD and a lot of people who have it don't even know. There is no cure for herpes, but there is treatment that can lessen the symptoms and decrease the likelihood of passing it on to someone else. Symptom. Most of the time, herpes doesn't cause any symptoms. When there are signs, they can include blisters around the genitals or anus. Number 7. Gonorrhea. Gonorrhea is one of the most common STDs in the United States and can lead to infertility in men and women. Symptom. Unusual discharge from the penis or vagina and/or pain or difficulty peeing. Men may have swelling in their testicles and women may bleed in between periods. Treatment. Gonorrhea is treated with antibiotics, usually given in a single dose. Number 8. Chlamydia. Chlamydia is one of the most common STDs and is the leading cause of preventable infertility in the United States. Symptom. Most people with chlamydia don't have any symptoms, but those who do might have unusual genital discharge and/or pain and burning when urinating. Treatment. Chlamydia is treated with antibiotics. Number 9. Bacterial vaginosis, BV. BV is the most common vaginal infection in women of reproductive age, and it occurs when there is an overgrowth of certain bad bacteria in the vagina. Symptom. Often there are no symptoms at all, but sometimes BV is accompanied by unusual discharge, strong odor, painful urination, itching, or burning. Treatment. BV can be treated with antibiotic pills, vaginal creams, or suppositories. Number 10. Syphilis. Syphilis is spread by contact with open sores. Symptom. Early signs may include a small, painless, firm sore in or around the vagina, penis, mouth, or anus. This can be followed by a rash on the body that is particularly noticeable on the palms of the hands or soles of the feet. Treatment. Early diagnosed syphilis can be treated and cured easily with an injection of penicillin or 14 days of antibiotics. Number 11. Scabies. Scabies are parasites that infect the skin and cause really intense itching. Scabies causes intense itching and a pimply rash. The itching will often be worse at night than during the day. Itching and rash most often show up on the penis, buttocks, wrist, nipples, waist, shoulder blades, armpits, elbows, and between the fingers. Prescription creams called scabicides can be used to treat scabies. Number 12. Pubic crab lice. Pubic or crab lice are parasitic insects that survive by feeding on human blood. Pubic lice are different parasites than head or body lice and are usually found in the pubic hair. Symptom: pubic lice can cause itching, blue spots or sores in the infected area. Treatment: prescription or over-the-counter shampoos or solutions can be used to treat pubic lice. Number 13. Pelvic inflammatory disease, PID. PID occurs when these bacteria move up from the vagina or cervix into the uterus and other reproductive organs. Symptoms include abdominal, cervical, or uterine pain or tenderness, along with fever or chills. Treatment: numerous bacteria can cause PID, so it is treated with a combination of antibiotics. Number 14. Mycopurulent cervicitis, MPC. MPC is caused by Chlamydia, Gonorrhea, or other STIs and can lead to PID if left untreated. Symptom: although MPC sometimes comes with no signs or symptoms, for women it can cause bleeding during or after sex, unusual vaginal discharge, spotting between periods, lower abdominal pain or pain during sex. Number 14. Molluscum contagiosum. Molluscum contagiosum is caused by a virus that can be spread sexually and by non-sexual contact through contaminated objects like towels, clothing, or sex toys. Symptoms: symptoms include shiny, smooth, white, dimpled bumps with a curd-like core and itching on the genitals and trunk area. Molluscum contagiosum will usually go away on its own within a year without treatment. Number 16. Lymphogranuloma venereum, LGV. LGV is most often seen in individuals who have had unprotected receptive anal sex. Symptom: the first sign of LGV is a small painless ulcer at the point of infection. It may be so small, in fact, that it goes unnoticed. Swollen lymph nodes are the most common sign. Treatment: LGV can be treated with a 3-week course of antibiotics. Number 17. Mycoplasma genitalium. Mycoplasma genitalium is a sexually transmitted small and pathogenic bacterium that lives on the skin cells of the urinary and genital tracts in human. MGen is becoming increasingly common. Resistance to multiple antibiotics is occurring, including azithromycin, which until recently was the most reliable treatment. Number 18. Genital warts. Genital warts are located in or around the anus and genital area. They are caused by the human papillomavirus, HPV, which often doesn't cause any symptoms at all and sometimes shows only years after infection. Genital warts appear as little bumps that sometimes form clusters with a cauliflower shape. Since they come in different sizes, treatment ranges from creams to surgery. Number 19. Vaginal yeast infection. A naturally occurring fungus called Candida albicans usually causes this type of vaginitis. An estimated 3 out of 4 women will have yeast infection in their lifetime. The latest medical researches show that 3 out of 4 women may get vaginal yeast infection at a particular point of their lives, regardless of age. In addition, women are very likely to have more infections in the future. The main symptom is itching, but you may have white, thick discharge that resembles cottage cheese. Number 20. Hepatitis C. It's estimated that about 3% of people worldwide are subject to chronic hepatitis C. Around 500,000 people decease annually from liver diseases provoked by hepatitis C. Symptoms of hepatitis C. 80% of cases are asymptomatic. Meanwhile, high temperature, weakness, appetite loss, nausea, vomiting, tummy pain, dark urine, pale bowel movements, arthralgia and jaundice can be among the acute symptoms. Thanks for watching. Please subscribe to my channel for more amazing videos. See you in the next video.